Welcome to the Genesis Healthcare Podcast, where we go beyond the traditional office visit to explore what it truly means to live with optimal health. Each episode brings you candid conversations with our Genesis providers and featured guests from across the health and wellness space, covering everything from primary care and prevention to aesthetics and lifestyle optimization. Whether you're ready to take control of your health through a Genesis membership or explore treatment options to look and feel your best, we're here to guide you every step of the way. Ready to begin your journey to better? Visit thegenesisdifference.com to schedule your first appointment or aesthetic consult today.
So we're here today. Ben Ezell, PA with Genesis, is here with Dr. Bo Westmoreland, good friend of mine for a long time, who has a Westmoreland Dental Group here in Johnson City. And we're going to be talking about facial pain, TMJ, and our lives together. So, Dr. Westmoreland, you want to introduce yourself to the folks online here?
Yeah. Thank you, Joe. Joe and I have known each other a long time. I'd say 20 years, basically. Is that about right? When the kids were little?
Sure. Roughly,
Little League days. And we both just kind of met coaching kids, and he came over to tell me how to do things. And I said, you go back over there. And no, that's not true. Joe and I, maybe a little. But no, we hit it off great, and just like we'd known each other forever, and we've still been that way. And I've had a few rough patches in my life, and without me even asking, Joe has always been there, and he just, I don't know, true friend, good person, good heart. But when I had COVID, when it first started, the first person I reached out to was Joe and his team here, and it was rough, and none of us knew what was really going on except we felt like we were dying. And Joe didn't beat around. He was like, yeah, you are. We're going to fix it, though. Like, great. But
I think you said, should I get my
affairs in order?
You said that.
Yeah, and you were like, no, it's not going to be there. But we're going. But anyway, I stayed in that room on that IV for all day. I don't know if you remember. I was just laid in that room all day, and he finally got me through it. But and I ended up sending a bunch of people out here over that. That was terrible times. But anyway.
You actually injected my neck on your follow-up.
Did I?
Yeah, I had so much TMJ from going under my teeth, not sleeping.
That's right. I went in there, and then we went back some area, and I stuck your neck.
So I've got personal experience with that.
Yeah. So anyway, we go back a long time, and I trust him with myself and my family and friends, and I think he does the same.
Certainly do, except with my own dental work.
Mm-hmm. That's a whole
This is my
story.
dentist. I see him once a year, shake his hand, and walk away.
And I
my wife calls me an anti-dentite.
Anti-dentite. Seinfeld, yes.
Yeah. So yeah, we've gone back from baseball, and it really is nice to have peers that we can socially interact with. We can joke around, and we can trust each other.
Absolutely.
So when I send somebody to you, I send somebody that I trust.
Yes.
And so that's a big reason why we're here today doing this podcast, is because I've trusted you and my patients. And so it's really nice to be able to say, welcome, and introduce you. So let's start diving in a little bit. Mm-hmm. Ben does a lot of the TMJ injections as well. So I'd love for you guys to kind of dialogue a little bit about some of the facial pain and some of the symptoms and some of the things that people don't even realize, because you brought that to light with me.
Yeah, when y'all
you injected my neck because I said, my neck is killing me.
Yeah,
and you're like, well, it's TMJ.
Yeah.
I didn't know that. TMJ was push here, hurt here. Right? That's
right.
all we were trained to do, So I'd love for you to go into that a little bit more as far as like symptomology that patients don't even really realize.
Yes, there is a lot, but yeah.
Absolutely. I think you brought up a good point, kind of how we're trained, just the TMJ, just that focal area there. And then we went and got trained over in Nashville, and you started to really dive into myofascial pain.
Absolutely.
Referred pain versus truly pain at the joint. So,
yeah.
And you've probably seen way more of that than I have.
20 years of it.
But I think it's really cool once you're trained that way, and then you have patients come, and so many people complain of it.
Right.
I mean, a ton of people.
It's astounding.
Yes, sir.
It's astounding.
And I'm sure we'll get into all the other symptoms and stuff that come along with it. But I think it's really cool, especially to talk to you about it. Just after my experience, after I got trained on it, just how you differentiate that, and you help people, like you said, that they don't even realize they actually have TMJ.
Right.
I just find it interesting.
Yeah, I see that almost every day if I'm in practice. I mean,
yes, sir.
I'll look at teeth first when I go in to do exams, and I can spot TMJ on teeth.
Absolutely.
Which absolutely confuses people. But then you start asking, like, do you hurt right here? And they're like, yeah, how'd you know? And I'm like, yeah, that's TMJ.
That's TMJ.
And that leads into the conversations
Yes,
I've had headache for 15 years, or I've had this X pain for 10 years. No one's known what to do for it. And it opens up a whole new world when you treat that.
Yes,
it's usually pretty quick relief if
Absolutely.
you do it right.
I think that's a cool point you bring up. In medicine, I mean, there's not a lot of things that are instant gratification, but this is one that's kind of instant.
It can be.
I just think that's cool. I mean, you get patients relief very quickly, and that's kind of it's a win. You can celebrate.
Absolutely. Absolutely.
They're happy. I mean, they feel like they've been taken care of, and
yes.
I think it's really cool.
I like the trigger points that you taught me, just for my repertoire to be able to inflict a little bit more pain on people. So I really enjoyed that.
You want to go to dental school?
Yeah, that's right. I'm like, man, this is awesome. I can inflict more pain. So I get my thumbs inside their mouth and hammer those jaws.
Yeah, people love that.
You did that to me, and I thought, oh my goodness, I'm going to soil myself.
Yeah.
That was great.
Yeah.
So I was impressed. So you taught me a lot of masochistic
I remember
things.
Y'all came out there to the office that night, and we went over everything. But I think one good thing to learn is to demystify, I call it. Because you hear TMJ.
Right.
Absolutely.
And you hear, well, I've got TMJ. Well, dentists kind of laugh because, like, I've got two of them, one on each side. And so, do you want me to try to explain some basics of it?
Absolutely.
So,
absolutely.
Before I get too far into that part, I've studied TMJ for over 20 years. Probably 25 now, actually. And I'm a member of the American Academy of Craniofacial Pain, American Academy of Orofacial Pain, the Academy of Facial Aesthetics. Been through a lot of training and anatomy, years and years and years. And I'm right now doing a second mini residency with the Craniofacial Pain group. It's about 17 hours of lecture, and you do an hour, take a test, another hour, take a test, and you get, more. And it's just incredible how deeper you go. And something I learned very recently that I really want to talk about that has just been discovered, like in the last year.
Okay.
So it's changed everything for a lot of patients. And I'll tell you, it'll probably blow your mind when I tell you about it. But so TMJ, everybody thinks popping, clicking, or pain right there. Okay. And, that is a component, of course. But it goes everywhere else in the face and neck too, or it can. It depends. Yes, so some interesting things about it. Facial pain, for some reason, really affects women way more than men. Okay, so women do not destroy their teeth, but they destroy their disc and their musculature, and it irritates their nerve. Men, overwhelmingly, do not have facial pain. It's less than 20%. Or if they do, it's very low grade, not enough to really disrupt their life. And it's fleeting, transient, it comes and goes. But they destroy their teeth. I mean, destroy their teeth. Yes. And what happens is one of the theories, and when you look at the teeth, when you look at male and female, and I'll look in there, women will have very distinct wear patterns we call wear facets on teeth in certain areas, where men will flatten them off. And it's very bad because once you get through the enamel, you get into what we call group function, and then you get into destruction of all the teeth. And you end up with a whole bunch of crowns. Wow. Women you'll see these little wear facets, and what happens is the way teeth, when they lock in, if you use your knuckles, they can't pass each other. So when they're trying to do what we call lateral excursions, when they try to go side to side, they get stuck. And that activates the musculature even more. where men grind them off and then they can just swing back and forth with no interference. That's part of the theory. The other part of the theory with pain is estrogen. That's the latest theory, is women's pain receptors are much more active due to estrogen levels, but that's not been proven yet, but it seems to be on the right track. But anyway, so back to some of the anatomy. So TMJ stands for temporomandibular joint. And in your head, there are 26 bones, and one of those is the temporal bone, which kind of a shape right in through here. And the mandible is the name for the lower jaw, maxilla for the upper jaw. A lot of people think the mandible inserts into the maxilla, and it does not. It inserts into the skull, into the temporal bone. And there is a ridge called the glenoid fossa, and the disc, the cartilage, sits right there to cushion the mandible. And it's like a little ridge or a little rise, and there's where the problem gets. So the fascinating thing about the human mouth is we don't chew up and down. We chew in an elliptical shape. And so you wonder, how does that happen? And it's fascinating. So the body's only bilateral joint is this, okay? So if you squeeze that side automatically contracts. You can't do one side or the other. You can't open half your mouth. The whole thing opens or the whole thing closes. This is the only part in the body that is powered by 4 muscles, and 3 of them you're not able to activate until you activate the first one. So the masseter muscle is a big, powerful muscle that runs about 45 degrees at the angle of the mandible and attaches to the zygoma and goes under the zygoma and becomes the temporalis. And on the inside of your mouth, if you had a skull, I don't have a skull here, but you'll find the lateral pterygoid and the medial pterygoid. The medial lateral pterygoid and the temporalis you cannot contract. So if you just sit here and try to contract your temple, like nothing happens. You just, nothing happens. But if you squeeze your masseter, you can feel your temporalis contract and get large. Same thing with the pterygoids. Now here's the fascinating engineering that just blows my mind, as so much of we all know the human body is a whole nother level of understanding, and everything we know is probably that much compared. I look at a higher power. I mean, I just don't think there's any way this all just comes together and works, okay? But that's another topic. But the lateral pterygoid is a 2-headed muscle, and the superior head attaches to the articular disc. And so when you contract your masseter, the lateral pterygoid superior head will pull the disc anterior and down, so you can translate and rotate your mandible down and unhinge it, so you don't sit there and chew like a little robot, blah, blah, blah. So we chew in an elliptical shape, and it all happens instantly. Okay, so what happens with TMJ patients is, due to a lot of reasons, human beings will grind and clench their teeth when they sleep. Everybody wants to know why. Why am I doing this? I'm like, I don't know. There is a stress component. There's also but you can't blanket that on everybody, just like you can't other things in healthcare. Sure. But some people just do it's called a parafunctional habit. They just grind their teeth or clench. Women tend to clench. Men tend to grind. It's not 100%, but it's about 80 to 90 in each of those categories. Whenever you are constantly clenching that muscle, you're therefore constantly clenching the temporalis. You're constantly clenching the lateral pterygoid and the medial. Okay, so just like if you lifted weights for 8 hours straight, and then the next night 8 hours, and then the next night 8 hours, you're going to start, this is going to get big and strong, and then it's going to start breaking down. It's not meant to do that. Yep. So you get spasms, you get lactic acid buildup. It starts irritating the trigeminal nerve, and it can be anywhere. Now, part of the problem with the lateral pterygoid getting stronger from working it out is it starts to pull the disc more. like a tug of war, right?
Yes, sir.
So as it starts to pull the disc out, it can slide too far. And then if it, like I tell patients all the time, you ever seen marathon runners, sometimes at the end they'll lose control of their body if they're, where your lateral pterygoid starts losing control. It can't uncontract and let the disc go back up. And just the wear and tear of that cartilage coming down through the glenoid fossa and out, it's supposed to slide right back in. We call that reducing.
Right.
So if it gets fatigued or damaged and you start getting degenerative disc disease, then it can't go back, and you get anterior disc dislocation without reduction.
That's the lock. The locking.
Yes, that's the part that scares people. When you're locked open, life is on hold until that moment is fixed, and people end up at the ER over that. If you're locked shut, people hate it, but they don't freak out.
Okay.
When they're locked open, it's panic time for everybody.
I had an ER patient who was a patient of mine, came into the ER with his jaw out, and that was.
You know what I'm talking about? They got the eyes.
Absolutely.
It's pure panic.
Yeah.
Heart rate's up. I mean, because you're like, am I stuck forever?
Yep, 20 of Valium, and it goes back in.
Yeah.
And he goes back to sleep, right?
That's what, we'll medicate them and inject them and ultrasound and laser, and then I'll manually pop it. Luckily, I've only had a few of those.
Okay.
Most are closed shut, which is easier to deal with. But so that's a little overview of the anatomy, pretty basic overview of the anatomy, but
from a patient standpoint, though, like, where are they hurting? I mean, like what?
Okay.
Like, I know what kind of patients that you have helped me with, because I thought TMJ was just like we said, just, I mean, it hurts here when I do that. When I open up, it clicks and pops, and that's the way we were trained.
my jaw hurts,
Right.
But which that is a
daytime
pain.
sleepiness, like when guys are grinding and clenching and firing muscles all night, where we're supposed to be in a parasympathetic state, and we're sympathetic here, and everything's firing, and we're not resting.
And I'm going to talk about that part too.
Right. And you got daytime sleepiness. We got headaches. You got neck pain. You got,
so
aura.
Yeah. You can get with or without aura.
Yeah.
So as we move along here, so if you, and I like to have a skull, I actually have a skull with the muscles on it in my office, and I show people. If you flip the skull over, you will see all the foramina that the 12 cranial nerves exit from. And if you trace foraminal valley where trigeminal comes out, and then you look at the distribution of the trigeminal, it's right where people hurt. And I can literally touch them all. So, and it always shocks people, like, how'd you know? I'm like, you just do, and you feel around. But,
I've done
so
this before.
the two complaints I get that people cannot seem to fix, and it's not your all's fault you can't fix it. You just don't have I have dental stuff.
Sure.
I don't put IVs in people and treat them for COVID, right? We all have our little area.
Sure.
Or if they hurt their ankle, I'm like, go to them. I don't need to do that. But where was I? Got all this info. Oh, the two number one complaints, well, number one is headaches, migraines, okay? It's such a catch-all.
Sure.
Absolutely.
Like if you had a box of tissues, what do we call that? It's a box of Kleenex, right?
Yeah.
It's not. It's tissues. It's the brand. Migraine seems to be an all-encompassing. It's like we here in the South, we say, give me a Coke, and it can mean a Mountain Dew, a Sprite, a soda of some kind. Migraines are really, and this is fact, according to the latest data that I've read, up to 93% of all headaches are TMJ. The other 7 are like 5 are hormonal and like 2 unknown. But that is medical in the literature. I read that not even 3 months ago. So number one complaint other than headaches or facial pain in general is eye pain. Second is ear pain or fullness or ringing or something ear, or the big one, which I have cured. I'm not saying that lightly. That's a big deal to say this, but I've cured vertigo.
Okay.
Dozens of times. Dozens.
Wow.
I mean,
that's impressive.
Absolutely.
I'm talking cured it. Like that day, I've watched it.
Yeah.
Now, either they're all lying to me, but they start crying and all this. I mean, it works. So let's break that down a little bit. And a lot of these are my theories, but also from other people that are more knowledgeable than me that actually lecture internationally on this. But I accidentally discovered this by accident one day. And I had a lady, it's a nurse, she's 43 now, so she was probably 40, maybe a little bit younger. And she came in with a headache here and her right ear just full. She says, it's like I've got a seashell over my ear all the time. No one can figure it out. I've been to my primary care. I've been to ear, nose, and throat. I've done an MRI. There's nothing wrong. And I said, well, tell me, let's go over. So we went through, I looked at her teeth. I'm like, you're a heavy grinder. We went through some sleep issues. I did some poking around, and I'm like, can I try something? And she said, knock yourself out. I'm not making this up. While I was injecting her extra-orally into the masseter, and I was going real slow with a lidocaine with no epinephrine, I was injecting her, and she went, oh, like that. Well, you know, if someone does that, it scares you to death. I stopped, and I'm like, what? What happened? I'm like, am I in a vessel? Did I hit a nerve? And she goes, my ear just popped open. I can hear everything you're saying. I didn't even move. She goes, oh my God, I can hear everything. And that was a game changer for me. And so I went ahead and finished. And she was like, yeah, I can hear everything on both sides. That's while the needle was in her face. So that was a big clue for me. And so since then, I listen to people if they have vertigo. And my favorite story is a lady that's about 75 to 80 now. And about 3 years ago, she came in to me as an emergency, and her son, who's my age, had sent her in, and we did a little dental work on her. She'd broken something, and as I was sitting her up, she started panicking, and she had a vertigo attack. And I didn't know her that well, so I didn't know. Well, she had been suffering from vertigo for over 20 years. Since about 2000. She'd been to the Mayo, she'd been to Vanderbilt, she'd been to somewhere in Boston. And I thought about that other lady that I had done, and I said, tell me more. So I got her back, and I started looking at all her teeth. And I started really noticing damage on her crowns and some natural teeth. And I said, do you have a history of grinding and blah, blah, blah? And she goes, I don't think so. No one's ever told her this. And I said, do you mind if she goes, do whatever. I stuck my finger and went inside and touched the temporal tendon, and she shot out of that chair. And I didn't even touch it that hard. I just poked right where the pterygoid and the temporal tendon. And I said, can I try something for your vertigo? And she said, honey, whatever. I'll never forget. She said, do whatever. And I went in there and got my ultrasound and got my lidocaine. I gave her 2 on the inside and 1 right here. And within 3 minutes, her vertigo was gone. Completely gone. Like I'm getting chills thinking about it right now.
Oh my goodness.
Completely. Like her family, her kids who are my age again, in the 50s, and her husband, they're like, come to the office. Like, what have you done? How did you stop this? And she's not had a vertigo attack since. That's been 3 or 4 years.
That's awesome.
And she was living with it.
You speak about the finances that has cost her.
Yes,
The
she's
quality
been
of
to
life and everything
Vanderbilt,
else.
Duke, the Mayo, and Boston, and I'm not criticizing any other health care.
It's what we know.
So we put her, I did ultrasound, trigger point, and got her in a night guard, the correct night guard.
Right.
She has not had a single attack and she's lived with them, like part of her daily life. Like her daughter was crying and like, you know, they didn't know. I mean, it's crazy. And those 2 cases changed my whole life as a professional, but also just as a human being.
Yes, sir.
You know, we like to help other people. That's why you go into this.
Yes, sir.
You did. There's no way you can convince me you didn't go in to help people. And,
yes, sir.
you know, that's healthcare people are wired different. We like bodies don't bother cadavers or science. You know, it's just what we do. Like accountants do what they do. Mm-hmm. There's nothing. There's like when you helped me with that and I felt better, I know you felt good.
Sure.
I mean, I paid you too. No, did I pay my bill?
I don't think so.
We'll go check after this.
Yeah, we'll look at that.
I
We'll
keep
look that
getting
up.
this guy named Guido. He keeps showing up at my door. I'm like, I don't know you, Joe Reid. I don't know anybody named Joe Reid. But yeah, the feeling you get knowing that, and that's why I went into it when I was young. I wanted to help people. I like dental.
It's the words of affirmation. That's one of the 5 love languages,
Yeah.
and I think that's the big thing for me. And
I always, that's just the way God made me and you, and it's just what we do. And I have taken those 2 cases and applied them, and I start digging into ear issues now.
That's
so
awesome.
let's discuss why that happens. You want to hear? It's crazy.
Okay.
Well, for me, it's crazy, but maybe y'all don't. So when
We're nerding out on the
I'm
ear.
nerding out so bad. But when I was doing that last mini residency with the American Academy of Craniofacial Pain, they were digging down into the anatomy, and they said, we got something new, and they were going through, and it's what's called Pinto's ligament. It's called the disco malleatus, I believe. And
I'll
so
take your word for that.
It is a ligament down in by the eustachian tube.
Okay.
And it is innervated by the 3rd branch of the auriculotemporal nerve, which is the 4th branch off of V3. Okay, so they're
So you're
saying
getting down there deep.
You're drilling down, and they just found this. It's super tiny. And sure enough, when I go in and palpate those certain areas, they're like, yeah, that hurts my ear.
Okay.
And I'll give them a shot extra orally.
So we're pretty proximal up here.
Yeah. Yeah. And if you look too, the greater auricular nerve is in here too. It runs up through the sternocleido and such. So, I mean, you got a lot of things. That's one of the biggest pains. If you ever hear anybody point, I bet you start, they'll say right here.
Oh, yeah.
And you're like, well, TMJ's here. But no, it's the greater auricular that is coming through the sternocleidomastoid. And if you look at the distribution of it, it just lays like that. I mean, it's incredible.
Absolutely.
And the weird thing about the posterior mandible, you can palpate it and it doesn't really hurt them. Because like if I poke their masseter, they're like, oh, God.
Yeah. Very easy.
You go right here and they're like, meh. Poke them right here.
Okay. Yeah.
Grab their sternocleidomastoid and watch what happens.
Watch them jump out of the
They
seat.
do not like you just poke it or
That's my
squeeze
favorite
it.
muscle anyway, just to say that word.
Yeah, it is.
Sternocleidomastoid.
Yeah, sternocleidomastoid.
Yeah. But
Poke
she
that.
sounds smart.
It does. It does. Try it. Watch what happens.
Yeah, I like when you taught me that too. I've been palpating a lot of those. I palpate the thyroid, and I'm like, hey, is this tender at all? But
Well, there's a lot of muscles on here, the floor, the digastrics and such, that are secondary and tertiary muscles off of the main, here and here. But so anyway, back to some more anatomy. If you look at that's the ear part. So really be in tune with that. You might be shocked at what you can do.
Sit here and think about how many people complain about.
even tinnitus.
You look in their ear's fine.
Yes, sir.
It's unknown etiology at this point, right? So
Absolutely.
you're like, well, maybe this, and you tried, and they're like, no, that didn't work, and try that, or send them to me, and I'll fix it. But I mean, I guarantee you, if you don't see something, anatomically wrong or redness, irritation, infection, I guarantee you it's that.
Okay.
It's always that. It's just is. It's amazing. The other one is eye problems. People will constantly report eye pain or eye pressure or twitching. It's usually the first two. So now if you go back and look at the anatomy.
So we're V2 or V3?
V1.
V1.
V1 is ophthalmic branch.
Okay.
Comes right here, and then it goes 3 ways. So you have infraorbital, then you have directly feeding right around the optic nerve, and then you've got the frontalis.
Okay.
And then there's another branch that goes to the temporalis. So that V1 has 4 branches. And when it's being pinched back here, the analogy I give patients, imagine a garden hose that has a sprinkler on the end with all the little streams of water, and you step on it back here, well, all the streams stop.
That makes sense.
Right? So if you're pinching here, the reverse, they're not stopping, they're firing. Okay? Because nerves only transmit 2 things, pressure and pain. So if you poke it, so back to something I left out. If you look at the anatomy, the way the lateral pterygoid runs internally in the temporal tendon combined with the masseter, The trigeminal comes right through it, and then it branches. So if those muscles are being worked out, they get bigger. Well, there's not a lot of room in the head and neck. I call it a nerve sandwich. Yeah. That's exactly. You see, now you're starting to click, isn't it? So those muscles get bigger, and they're also irritated. They're inflamed. The pH is bad, acidic. Well, they're bathing the nerve in a terrible environment, and they're compressing it a little bit, impinging a little bit. Yep. So you start getting these fires. It can be there, it can be here, it can be here, it can be here, it can be. So now we get into V2. But ophthalmic is a huge problem, and you'll see people go, it hurts right there.
Sure. Right.
And they'll poke it. But yet if you poke it, it doesn't hurt.
Doesn't do anything.
That's the frontalis, and that's because ophthalmic V1 is being irritated back there. So what I'll do to test it, I will go in there and do an internal trigger point, which I would just be blunt. I'll be careful doing that. I'm really trained in there. I think it's smart for you guys to be doing external. I don't know that I'd get internally much, but I will go up in there and do what's called a hamular block or a V2 block, and it'll actually get to V1 if you got to be really careful. But within a minute, they're like, yeah, that's not hurting anymore. Like, this is not hurting, or this is not hurting, and it's because I'm blocking it back there internally.
Okay.
So that makes sense?
Yes, sir. And I feel like I've heard. I can think of patients now complaining of pressure.
I could see you thinking. You were like, that's what that person had.
And that's interesting to think about going forward.
Yeah. So the next part you get into is this window. So if people, this is a trick, like I love to say, I will sit down in a chair and shut the door, tell me what's going on. And then I don't talk. I like to talk, okay? Joe and I, that's why we get along well. You know, see, but like neither one of us know what the other one said. But I listen, because if you listen and be a true healthcare professional, patients will help you they will burrow down for you, but you got to be listening.
It's tough to listen on a computer screen, isn't it?
I don't. I turn my back to it. I look at their x-ray first to make sure there's not an obvious, and we'll get into some dental pathology in a moment if you want, where I really nerd out. But
well, I do think that I tell my students this all the time. I said, your eyes and your ears are the most important thing that you've got.
It's a huge,
most important tools you've got.
Yeah,
you listen to people, and they'll tell you.
Yeah, they'll
give you a tell, and you'll watch it with your eyes.
They'll
start looking off, or they'll say do this or that, and you go, what's really wrong?
Yeah, because exactly. And I've actually had people break down, start telling me about all their personal
stuff. That's where the Kleenex comes in.
Yeah, but here you go. I'm sorry.
Which is okay. I'm not.
Yeah.
I like pain. Give me more pain points.
Why are we friends again?
It's
so
you give me two.
So if you watch them, the weird one that you may get is they'll point like let me tell you where you will get. I've constantly got sinus infections, but yet nothing's coming out. There's nothing coming out. There's not green discharge. Yep. There's not fever.
Sure.
And they'll do this. They'll do that. They're tracing V2. They're tracing maxillary nerve. Right. It goes right through here. It has multiple branches, posterior superior alveolar, middle superior alveolar, anterior. Anterior superior goes to the side of the nose, and the middle and posterior go to the sinus cavity and the teeth. So they will feel like they've got sinus problems.
Sure. I know that complaint all the time, teeth.
Yeah.
My teeth are hurting.
So then you think maxillary sinusitis, which is a fair assessment. At my office, I don't know what you all do here for imaging, but I've got a cone beam that's like an MRI 3D that I can slice through, and I can tell you if you got a sinus infection. I look right at it it's cloudy or not. It's very high def, and I can tell you. And if there's nothing in there and it's black, completely radiolucent, then I know you don't.
No fluid.
No, you got nothing. I can see it.
That's cool. Or
it'll be completely occluded over, and then I start leaning more toward that. But so you got to go down the differentiation tree a little bit. But if you go, you'll find if you can take care of that, a lot of this stops. Okay. Now the V3 is a tough one. Or mandibular branch of the trigeminal. So you've got lingual nerve that feeds the floor of the mouth and the tongue. You got inferior alveolar, which feeds directly into the teeth. You've got long buccal, which does the outside of the teeth, the gums, the gingiva, the buccal mucosa in the skin. Okay. And then you've got the fourth branch of that is the auriculotemporal, and it comes right here and wraps around. Okay, so a lot of people will do this one. They're like, it's right there, and like not in my ear, and it's not in my joint, it's in between. Okay. So if you go back and look at the anatomy, you'll see the auriculotemporal running right there and the greater auricular. So it's a little, but you know you're on TMJ at that point. Okay. So the problem that I run into is people come in with their teeth hurting, which happens. If you have severe TMJ, they're like, so you can quiz them, do your teeth hurt? Yep. Sometimes it will be a tooth. I had one yesterday or the day before. She was describing TMJ dead on. And I'm like, yeah, I'm thinking she's got TMJ. This will be easy. I got her cone beam in. She had a massive infection of her lower molar. I mean, that big. And I couldn't see it. Her neck wasn't swollen. Man. And I'm like, oh, never mind. You're going to have a root canal now. But she does have a history of grinding and TMJ problems. Sure, so you've got to, the diagnosis is really, you got to listen and you got to look. Sure. So anyway, that's kind of a broad overview, but I don't know if it helps.
I think that was great. And I think during our training, the Academy of Facial Aesthetics, when we got trained by them.
Did you go through that?
Yes, sir.
It's a great course.
Fantastic.
It's incredible.
JC, one of our other providers, went through it as well.
I know JC.
Great course. Yeah. Thought it was really interesting. There was a lot of dentists in our course, and they had mentioned that how many times people come in, you think it's the tooth. Maybe they haven't been trained, maybe like you or other dentists. And I just thought it was really cool them talking about how many times it's not the tooth, it is TMJ, and somebody gets a tooth taken out.
It's over.
So,
well, when I was going through that training,
crazy.
And I still remember, I did that back in 14, maybe the first I've done all three levels of their facial pain. It gets really deep on that second and third one, but they put up an X-ray.
Send us back.
No. I'm just trying to think about how you would spell some of these muscles.
Agreed.
Joe's in his own
I'm
world.
still over here trying to spell.
He's like my golden retriever.
I'm like, how do you spell that? Is the pterygoid, does that start with a P or a T?
Starts with a P.
But I will say, like TMJ or trigeminal neuralgia in general, when I was trained, even doing neurosurgery, we would do suboccipital decompressions.
I know.
And put Telfa in between.
It doesn't have to be done.
Right. And I'm thinking, the suicide component to trigeminal neuralgia was 11% of the people who had trigeminal neuralgia killed themselves.
They call it the suicide disease.
Yes. And it was like you brush your teeth, fire.
Yeah.
You walk outside in the cold, fire.
Yeah.
You think of a good thought, fire. You never knew when it was going to happen, and so this is not just a benign. I'm not getting much rest.
That's correct. That is correct. So trigeminal neuralgia, if we think about that term for a moment. When I was in dental school in the 90s, they said, if you get trigeminal neuralgia, there's no help. There's no treatment versus
4,600 milligrams of gabapentin.
Yeah, that's it. Just medicate, and you're going to live in pure misery. Well, when you break down the name of it, trigeminal, okay, well, neuralgia. I mean, we treat neuralgias. Sure. Okay, it's not a death sentence for people now. I mean, I've treated at least 100 that have had trigeminal neuralgia, and I've gone in there and fixed it in a day. And I've had a couple. I've had 2 women that both had neurosurgery and had the trigeminal cut, severed, and they're permanently numb, but they still have the pain.
Oh,
yes,
wow.
They still have motor function, but they have no sensory. But they still have the facial pain. And I'm just like, oh dear. And I'm not saying anything. I mean, neurosurgeons saved my life with my back. I mean, I'm not saying Ken Smith saved me. He saved my career, saved my life. But there are things that can be done for head and neck pain, facial pain. And most, at the risk of but I'm just being honest. I've been doing it 20 years, and the last 12 really advanced. I cannot think of a single case that I've not stopped their pain. And that's a pretty big deal in healthcare to get as close to 100%. Really, that is. I mean, you don't get 100% in anything. I think I may have had one person, but I can't even remember. I mean, the vast majority of this is treatable, and people can have their life back. That's what I try to get the point over. Absolutely. And I'm very passionate about it, as you can tell, because I didn't tell you this part. Or about 20 years old, I started getting migraines. I used to call them pounders because my head would pound like my heartbeat, and like my right eye would just almost be shut. And I went a few times, like, oh, you just got a headache, you're fine. You know how we treat guys.
Suck it up.
Suck it up. This went on.
How many fingers am I holding up?
Yeah, you're fine. Take some Advil, you know. Well, this went on through dental school, and then when I did a TMJ rotation my 4th year, I went, what? It was only like 3 weeks. And that's all they don't do that. That's unknown. I'm like, no, wait a minute. Wow. And so I started really getting into it, and I cured myself. That's really cool. Hardly have any headaches now, ever. Every now and then I'll get one come back if I don't do the protocol, which is basically wearing a night guard. You know, the correct night guard. Do not, night guards, I don't want to get started. You got to do the right one.
You don't go buy the little mouthpiece from Walmart.
No. That makes it worse. Okay, and I'll tell you why. So you got to get wound up on this. Teeth have, you know how your fingertips and toes, that's how you communicate with the world, right? Yeah. Your teeth, the proprioceptive ability of your teeth is astounding. Have you ever gotten a piece of sand in your tooth or teeth at the beach? Well, when your teeth have something on them, what do they want to do? They want to squeeze. Yep. So what have we learned? TMJ is a neuromuscular issue. Yes, sir. So when you start chewing on that over-the-counter or that Amazon night guard that makes me cringe, it just fires it. And they're like, yeah, I got this, and I've gotten a lot worse. I'm like, yeah, I told you not to get it. They're like, yeah, I know.
That's a really important point, though, for people to think about, because a lot of people do that and they think they're doing something right. Yeah. They mean well.
They do mean well, I always tell. I never discourage them. I say, go ahead, but if you need me or when you need me, because it likely will get worse. Yes, and so far, I can think of one person who said it helped them. Okay. The rest have all. Because I was like, really, and it was a guy. And if we go back and remember, most guys don't have pain. I've never had a female patient that got an over-the-counter guard that it helped. They're like, oh, my gosh, this is so much worse. I'm like, let me fix you. And once I do it, like if you could read some of the testimonials, I had a lady write me a 3-page letter. A 3-page letter with all her history of this.
Awesome. I did too.
She's
it was 45. Not positive.
Do what?
Mine was not positive. It was 3 pages.
Well, color me shocked. So let's talk about something else real quick. Okay. Am I overwhelming the situation here?
No, I think this is great.
Okay. So let's look at the mechanics again. Okay. A lot of things get put a mystery on. We can go back and look at fundamentals. You're a golf or baseball person, right? And I know you were. When you break down the fundamentals, it usually comes down to some simple things, okay? We like to make things overly complicated, and a lot of times they are, but a lot of times they're not.
Yes, sir.
So sleep apnea. This has been proven in the last 2 or 3 years, just a couple years. The vast majority of sleep apnea is due to TMJ. The reason is it's a mechanical... They lock down their teeth like this, and they clench. Their airway closes down. Their tongue goes back. When you bite down, let's just do an experiment. Okay. Bite your teeth together. Let me see them. Okay. You don't go like this, right? You do this. That's what dentists call maximum intercuspation or centric relation. Okay. When you bite in centric relation, your mandible, by definition, goes backwards. Okay. Then your epiglottis.
Everybody just bit their teeth there.
Yeah, I hope they did. Your what's called the velopharynx and the oropharynx, that all compresses. And like on my cone beam, when you take the cone beam, we can do a sagittal shot. It puts it up in 5 different views. And when they bite down on the sticks, we can look at their airway, and that sucker pinches right down, sometimes to nothing. And then you look at another view, an axial view, and you can see the airway just go whoop, down to nothing. Then we get them open and do mandibular advancement. So we open and bring you forward, and you can do this at home. Okay. Bite down and try to breathe through your mouth. Now open your mouth and breathe. It's like the air goes flying in. Okay, so what's happening is you would not believe the way people grind and clench. I mean, they lock down, and I've watched time-lapse video and seen recordings where they put sensors on the masseter muscles and record it. Okay. When you're like this, you can't get into the deeper REMs, okay? Because when you get to the last REM, you have to have a patent airway. That's reparative sleep issue, right? Well, if you're not breathing and you're suffocating, what happens? You wake up and you're awake, and of course your hormones are going nuts. Now you got to go to the bathroom. Yeah. Well, then you lay back down and you repeat this thing. An hour later, you're back to sucking air and waking back up. And before you know it, you never sleep the 6 to 8 hours you need to repair. It's constantly interrupted, and more importantly, you never get to the last REM.
Is Inspire helping with that?
What I have seen has been overall good, but I've had several that are not good. Okay. The Inspire, the idea, they attach the lead onto the hypoglossal nerve, cranial nerve 9, and it shocks, I guess, or moves the tongue forward. Right. But you have this scar, and you have to have it implanted in you, which is, I mean, if that's what you want, that's fine. That device that I make for sleep apnea does that for you. It's like a double night guard, and we open you up and measure you forward, and then we make this guard that has these little pins on it, and it's very thin, and it pops you in and keeps you open in your air. Okay. And I have got the best. If I can find it, I just thought of this. Can I look for this? I'll show you something fascinating.
How about no? Okay. So I'll just take me for example. I had an underbite when I was a child, and they gave me these apparatuses to pull my jaw back, and I had a cone here that pulled my teeth back, and so everything has been talking about trying to get this, and this is as far back as I go. All right. Yeah. So that's
so you're what's called a class 3 malocclusion.
So they pulled me back, and so I lay on my back, and I'm going.
I will guarantee you've got sleep problems.
Yeah, and I wear a CPAP because of it.
Yeah. See, I've replaced
just because I snore so heavily.
Okay, so what is snoring?
My tongue getting back there and closing down my airway.
Snoring, we go back to what's the simplest thing. It's the mechanical blockage of the airway. So in your all's life, you have to treat high blood pressure. What is high blood pressure? Well, the diameter of the vessel is smaller for whatever reason. The heart has to pump harder to get the same oxygen and blood through there. Okay, with your airway, your body and your brain still needs the exact same amount of tidal volume of oxygen molecules, right? Mm-hmm. Yep. So when you're not getting it, you start pulling harder. Well, when that air is going through a constricted spot, the soft palate starts to vibrate, and you get the sound.
No, I get the elbow.
Yeah. Is that why you come in with black eyes a lot?
I don't know what happened last night.
I don't know, honey. I don't know.
The dog and I were playing.
Yeah. It's a total mystery. But that device I make stops the snoring. So here's what I was going to show you. This lady I saw the other day, this was her sleep pattern. She recorded it on her iPhone. And, okay, so you can see the ups and downs. Yeah. And she sent me the first night she wore it. If I can find it, I wasn't prepared, I'm sorry. Oh, there it is. It's the first one. See how flat it is? Okay. I mean, she just stayed. That was the first night of wearing the device. Wow. And she's like, I cannot believe how much better.
She was apneic?
Yeah. Total. I mean, her sleep study came back. I don't remember how many AHIs she had, but it was a lot. And she's small and thin. You know, sleep apnea is not a 55 and above overweight man. It can be, but there are people that are 20 and skinny
Sure.
that have it, and anywhere in between, and a lot of it. So you start asking, well, how? How can a 20-year-old female who weighs 85 pounds, how can she have sleep apnea?
Talks
She
like that
grinds her
big tongue.
teeth. She grinds her teeth. She locks down and blocks her airway.
Sure.
That's all it is. And we
interesting.
overthink it, and we're like, we don't know.
You don't fit the picture.
You don't fit
if,
the picture. So when you start thinking outside the box, I've made 175 units, 178 of these new sleep apnea devices, which are light years above what I've used for my whole career. The advance in it is incredible. Every single one, 100% are life-changing for these people,
That's awesome.
which is really, again, astounding. You don't
You have
get
an opening next week.
I do, yeah. Go today.
Do not. Trish is not allowed to see this podcast.
Yeah, Trish, call me. Let's talk. Anyway, so that's all. You see how it's all combined, and you can see how miserable people so you're not sleeping, you got facial pain, your teeth hurt, you got headaches. They can't live their life. They're in a bad mood.
cycle.
Their marriages suffer. Their relationships with friends and kids suffer. On and on, whatever it may be.
Absolutely.
You go in there and you get their sleep fixed and you get their pain gone. They're completely different people, and they write me letters. They come in and hug me and say no one has fixed this.
The number one diagnosis that we see in here is fatigue.
Yeah.
Oh, yeah.
Yeah.
I mean, it's fatigue.
Yeah.
It's fatigue. And so we go, okay, so let's do some blood work. Okay, we'll look at a CBC. We'll look for iron deficiencies. We'll look for, we'll look at hormonal issues. We'll look at, and everybody wants to see their cortisol levels, right? And I'm like,
Yep.
Okay, well, whatever. There's a shot in the
Got any
park.
stress in your life?
Nobody has any
Nobody, I
stress
was
in
going
their
to say
life.
we all.
Right. Or we
We
wouldn't have
all,
TMJ, right? But, sleep is, it is so important because very few people wake up and go, I'm ready for the day.
The people wearing this do.
Right.
Yeah.
And so
really
this
cool.
is so important for, I think, people to understand that there is something else
That can help.
Hormonal balance is great, but if you're spiking your cortisol in the middle of the night because your blood sugar is going down, or you're not getting into deep REM sleep,
Correct.
We're getting legit
Correct.
symptom relief, and if you get the rest through the night, if you get true rest through the night, then all of the other things balance.
Correct.
I mean, like the endocrine system balances itself.
Yes.
We have been
You can get the
beautifully
homeostasis.
and wonderfully made by God. I'll say it.
Yes.
All right. So we have been beautifully and wonderfully made to fix ourselves too.
Yes.
And so
So what are the three pillars of health? Exercise, diet, and sleep. And if you are very deficient in one of those, the wheels can come off. And
absolutely.
the vast majority, because most people eat pretty good. Most people get some moderate exercise. I don't know. But sleep is awful. Sleep is awful
Agreed.
in America. The studies are out there. I watch it, I read it, I see it in my own practice. When you get that fixed, it is wild how fast people go back to homeostasis. Blood pressure goes down, heart rate goes down. I don't think enough credence is given to sleep disorders. No. You look at AFib, stroke risk, it's kind of scary.
Well, look at your most unhealthy patients. Typically are police officers because they're on these swing shifts.
Yeah, they don't
They
sleep.
never get a sleep,
No.
a steady sleep.
No.
I mean, like, these are fit, healthy,
But
physically. I mean, like,
That's a fascinating point.
but they don't sleep well. And they're just broken down all the time.
Yeah.
Great guys. Love them to death.
Yeah.
But they come in here and they're like, oh, man, I'm just dying.
Yeah.
I'm just worn out.
But that affects their whole
Absolutely.
body. Their whole body.
Yeah.
So, yeah, you're dead on it. And they don't sleep. They have days where they're doing regular, and then they got to do all night, and then they got to try to sleep during the day. And I guarantee you they're all out of whack, even though their blood work may be all within normal limits.
And they're physically just studs.
Yeah, but
they
they're
look
just
great.
wore out.
Yeah.
So anyway, you can tie all this together. I know I've talked and taken up a lot of time, but you can tie all this together, and it's been fascinating to watch the change in people. and to fix their sleep problem and fix their pain.
Yep.
And just by getting their jaw stable, you would never have thought it. Like I never did until I started doing it every day and studying, because there's a lot of information in the world. You just have to go look and really, and getting into the, how did you all find the AAFE?
JC actually
I
did
think
a
I
bunch of
told him
research.
about it.
Okay.
I might have, because I think when y'all came to my office a couple years ago, I've got that big AAFE in there. That's the best, I think, and I've done a lot of different places.
Of course, I had to pay for all of it.
I know how that is.
Thank you.
Can you pay for my next meeting? Yeah, sure. Anyway, you learn if you do the higher levels, but anyway, anything I can do to help. Like Joe and I were talking, I don't mind. I'm starting to kind of get into the semi-retirement part, and I'm getting away from dental surgery so much because my hands are starting to get tired, and I'm wanting to finish my career over the next 10 years or more, just doing facial pain and TMJ and sleep. And that's kind of, we don't have a provider in the Tri-Cities,
yes, sir,
except me. And I'm trying to start marketing.
And it's not easy to get into you.
No, it's not.
No, and that's a good thing.
Yeah.
But it's really tough. But having people that you train and it's kind of nice to have some ancillary folks around too.
Yeah, it does.
And my wife's a dental hygienist, and they send people to you.
Who?
Often.
Where she work?
She works for Martin Dentistry in Elizabethton.
Yeah.
She worked at
What's
the
her
Johnson.
name?
Lacey Reid.
Well, they have had a few people say, like I came from Martin in Elizabeth, and I guarantee it's her. What a small world. It's so wild.
But I told her, I was like, send those people to me. Why are you sending them to her?
That guy don't know what he's doing.
Okay. No, okay. But they think very highly of you. You do a great job, and I know you're well respected. So
I appreciate it.
But it is. You're hard to get into because you do a good job, and there's a lot of people with those issues.
Well, we won't let people suffer. I mean, we'll get suffering people in pretty quick.
Absolutely.
And, it's really gotten a foothold. It's hard to. You're right. It's hard to get in, but I'm there every day, going as hard as I can. So if there's ever an urgency, I'm happy to do it after hours for you guys or whatever. But
that's awesome.
Anyway, we do a soft tissue laser for the disc. We do ultrasound. We do Botox. We do night guards, and we do trigger points. So any combination, I tailor each person very carefully and do as little as I can to get them where they need to be. Absolutely. So anything I can do to help your all patients.
Well, that's important because I wanted to make sure that you said these are the things that I do and I can do.
Yes.
Because and a lot of people, like the lady who you said went to Mayo and went to Vanderbilt, went to all of these places. I mean, there's a huge financial outlay for that.
I had a guy going
fuel cost.
Yes, I had a guy going every 3 months to the Diamond. It's called the Diamond Headache Clinic in Chicago.
Right.
He was going up there every 3 months. Airline, food, hotel. Wow. I fixed him. And
right. Well, and
I'm
so
like,
that's kind of what I want to get across to people is it's not inexpensive to do these modalities. I mean, just the mouth guards are not cheap. I mean, you can go get you a bike, football mouthpiece and put that in there, and that'd be great, right? But the financial part of it, people kind of balk on that. But the quality of life and the savings of money and time.
Oh yeah.
When you can say, well, I can go in there and inject this, and within just a week or two, or within minutes, you're better.
Yeah.
And
also when you look at cost of things, okay, so I not to get way off the subject, I grew up with a single mom that raised me and my brother. We lived in my grandmother's house, okay? We grew up with very little. I understand and I respect financial problems to the nth degree.
Sure.
And I try my best to keep costs down. My night guard, there's only a few dentists in the state that make the one I do for the sleep apnea guard. The closest is Knoxville. His is $5,000. I charge $2,400. The TMJ headache guard, average fee is $3,000. I charge $600. Ultrasound, $25. Trigger point, $50. I mean, I try my best to keep the fees way down. But let's also look at something. Value.
That's exactly what I wanted to get to. Yeah.
I get amused, and I don't mean to step on any toes, but someone will pull in a $50,000 to $80,000 vehicle and then hassle me over a $50 dental visit. And I don't have, it comes down to if you spend a little money in yourself, on yourself, to feel better, is it worth it to you?
Right.
Okay. There's a lot of people it's very worth it. And I try to keep the costs as minimal as I can and still run a business. Just like this place is a large healthcare business. It takes a lot of overhead. And the providers that go through all this training and all these years of school, we still have to get paid, otherwise we live in a box and then we can't help you at all. Right. But
it creates a lot more TMJ.
It sure does. Yeah. But what is it worth to feel better? Can you make a better living at your own job if you're feeling better? Or is your relationship better with your spouse and kids and
the
friends?
longevity of your health care.
Yes. I mean, I always liken it to a car. Do you get the oil changed? Yes. Why? It's a pain in the butt to go sit down there and wait and get the oil changed and get a ride. But if you don't, you're going to drop $5,000 on a transmission when it breaks down. So we all go get our oil changed.
And it gets really expensive.
That's really expensive, yes. Or you can do the little oil maintenance every 3 months or 5,000 miles. So taking care of your body with you guys, is paramount to your health. Do a little investment as you go. Do yearly physicals. Do yearly blood work with you guys. Take care of chronic issues so you can live a longer life and be more productive in that life.
Absolutely.
Like I don't understand. It's an odd mindset that we're conditioned to drop $50,000 on a vehicle, but we won't spend $500 on our own bodies. Like I can't. Oh, yeah. I have a hard time. I just have never been able to understand it.
I agree with it.
And I grew up with nothing, but my mom always made sure we took care of our teeth and our eyes and made sure we had health care insurance to go to family doc. I mean, you just got to take care of yourself.
We've
there's
kind of been
nothing wrong with
brainwashed
that.
into
We
that
have.
too.
We have 100%.
But FDA guidelines
100%.
that come down with our food and, food pyramid, all of those things have just basically kind of brainwashed us and saying, the $20 copay of the 90s and 80s and 90s was like crushed us.
Yes.
Because everybody's like, well, this should be just insurance should pay for everything.
As I always say, well, here's my magic card that has the money fall out of the sky. Well, that's, you can talk to a lot of people, and I'm not trying to. This is more of an indictment of our health, of our system, is in high school, we should be teaching high school kids, this is how healthcare works. This is how they think we're all just loaded. Try to run a business.
There's a money tree out here.
The money tree. Go
it's actually right back there.
Yeah, just poke it.
It'll grow some hundreds in a minute.
Yeah, I think what we do is a fair fee, just like you are. It's a fair fee. It's y'all are great here. My office is great to people. I always tell people, I didn't make the rules. I didn't create the system. I'm just trying to live in the system and be fair and work hard for you.
I'm trying to destroy the system.
Not shocking. You going to erase that part?
Don't erase that part. No, I don't like the system. I don't like the system that tells me that I have to be a certain thing to a certain person.
Right.
Like I like to use my eyes and my ears. I don't like to use the computer. Right. I don't like to use. I'm very proficient at the computer. The girls are like, "Why don't you use the computer?" I'm like, "Because I don't want to." Yeah. Then I lose my eyes and my ears. I lose the tail. I mean, I'm a pretty decent poker player because I can watch your tail. After a few hands, I'm going to know what you've got in your hand because I'm watching you and I'm listening to you. And so it's pretty easy. And so we're conditioned over the last 20 some years of practicing. We can look at somebody and they're going to give us a tell when they start drifting off their eyes to upper right or upper left. And they're not wanting to talk to you.
That's why this office is so successful is you listen. You sit down and listen to what the patient is saying.
Absolutely.
They will guide you into the diagnosis through the diagnosis tree. You just have to listen. Yep. And so much of healthcare is go, fat, this, okay, what's your problem, blah, blah. No.
5 to 7 minutes.
Like, obviously, you weren't here when I was out here with the problems, but Joe and JC and them treated me like I was the only patient in this building to where I actually thought, am I the only sick person? I remember laying there like, because they kept coming in, and I'm like, am I the only person here today? And then I go out and there's 100 sick people, but I never knew it.
We were trying to spread it as much as possible.
Just keep business going.
Yeah, keep business going.
It's a good business model.
It was. I mean,
Joe Reid's always sleeping.
We were slipping our business cards in your back pocket.
Oh, you got COVID? I'm sorry. Take these out. Shake hands with everybody. You don't need to wear a mask. Just, it's all good.
Oh yeah. So, but yes, I think that's been something that I tried to get away from after being in corporate medicine and insurance companies dictating how I could treat somebody.
Yeah, it's awful.
And it basically creates us to be liars and cheaters.
That's why.
I mean, how many people have a 7-page office note? I mean, how can you do a 7-page office note?
If I went by the insurance, okay, and I caution patients to be careful when you just want to say, well, does my insurance pay for it? Well, they'll let you buy the worst night guard possible, which will make you worse.
Sure.
Let the provider figure out what you need.
Yes, sir.
Mm-hmm. I don't know how you guys do with your financial systems, but like you can set things up on 12 months, 18 months with no interest. I mean, we try to make it painless and simple and fix you. Well, I think people should look at it as an adjunct to help. It's not a full system. If you read it, most people don't even know what their insurance is. I mean, you wouldn't believe the people that come in my office that don't even have the card. Like, I don't know, my spouse does all that. I'm like,
my agent does all that.
Yeah, I'm like,
I mean, literally, that's what I hear. My agent has that. I don't even know what it is.
Yeah, exactly. And I go back to like, where else in society, other than the dentist office or the family medical office, where else other than those two places do you just go and not pay? If I go to Food City and go, you know what, just bill me for this, they'll be like, security, and then I'm on the news, local dentist, robbing Food City, a bunch of bread. But
it's a great point.
It's just it's an odd, like you said, we've been brainwashed and trained.
Right.
The insurance system, the people that get rich are not the providers. It's the management of those places denying the claims.
And they're the puppeteers. They're getting money from us.
Yes.
Because we're consumers of insurance.
That is correct.
And we are the providers of the health care. And so people think that they have the insurance and that assurance of care, and they have neither. Like when Trish was sick and going through chemo, we had our premiums plus deductibles was $25,000 a year. Before we were covered, we had to meet the premiums of X amount plus the deductible, and we met it every year. That was a total of $25,000 a year. We were not insured until we paid $25,000 a year. So
and then it's not insured all the way. It's just
at that point it was with that insurance. But some of them are 80/20s, and some of them are 60/40s, and some of them are only if you stand on your left foot and can juggle like knives.
Yeah.
And so like it really is something that people have been brainwashed into thinking they have care, which insurance companies care less.
That's correct.
About your health. They want the premium, and they want us to jot and tittle everything that we can. And if we miss something, they deny it.
Yes.
And so we don't get paid. I mean, I've lost thousands and thousands of dollars here throughout the year. We both have done that. All of us over
hundreds of thousands of dollars.
Just the wrong name or the wrong check mark, right? And so it has basically created liars and cheaters out of us, as in the healthcare, because we can't keep up with their documentation. So we just document everything.
Right.
And so I just said, the heck with it. I'm not doing that. So anyway,
that was
we gave them
smart.
Actually, we can actually use our eyes and ears still, and we can sit down with people, and this would be a typical office visit for me and you.
And see, but it comes down to what those people value. They want you to do that.
Sure.
They trust you and want you to do that.
Well, everybody wants that.
But they're willing.
They're not willing to.
That goes back to the value.
The
part.
value, exactly.
You
everybody thinks that their doctor or their provider is thinking about them all the time because they saw them once a year and looked over their blood work, and they were like, "Well, he's taking care of me."
Yeah.
And I hear it all the time. I'm like, you need to get in here because I don't think about you.
I'll give you an interesting way to think about value with healthcare. Let's say I had a sports car, Corvette, whatever, name it, Porsche, whatever, some kind of sports car. And say it was fairly new. And I said, you know what? Here's the keys to this Corvette. It's a 2020, $3,000. What? So you're like, what? Even if you did not,
I'll take those keys.
You would figure out a way to get that $3,000 to me very quick. And I say it's got to be within the hour. You would have that $3,000 in cash in my hand.
Sure.
Now, if it comes down, well, you got to spend $3,000 on your own body. People are like, well, who's paying for it? Well, it's your body.
Yeah, absolutely.
The $3,000 is irrelevant. It's the $3,000. How bad do you value that car?
What do you
versus
value?
Do you value your own body? I can't unless you're in severe pain. That's when you will. You'll do it. But it's an odd disconnect. That I think you use the word brainwashed. I have used that before. We are brainwashed to, the old riddle. If you're on a plane with a little kid and they lose the air or the oxygen decompresses and the mask comes down, what do you do with your child?
Well, hadn't been there
Step
yet.
on his throat.
Well, what if you ask that riddle to someone?
Yeah.
What do you do?
I mean, I guess you're gonna try to help the child
Wrong.
first. I mean,
Because you're going to die
first.
Yeah.
You got to take care of. You put the mask on yourself so you don't pass out. Then you take care of the child. Okay, so that's exactly. We can for some reason.
I love
don't
you,
want
Reid. I'd
to-
save you first. Yeah. Love you.
But if you both pass out, Anyway, that's an interesting riddle to think about your own self.
Sure.
We don't, and a lot of it, Americans, we're not very selfish people. A lot of it, we try to help, but sometimes you got to take care of yourself.
Sure.
I love the analogy. I didn't come up with that. That was at a meeting. $3,000 for this Corvette, $3,000 for medical tests. Well,
Priorities.
Like I don't want to spend that on myself. What's your body, dude? Do you like? We expect something else to pay for our. We've all been trained that way.
Sure.
Ever since I was a little kid, I remember my mom paying the copay with the card. I'm like, how is that card paying for all that? I just didn't understand it.
I remember writing a check.
Yeah, she'd write checks.
And then they'd write a check, and then all of it was done by the insurance company.
Yeah.
You'd write the check to the doctors at the doctor's office.
Yeah.
They'd take it, and then Blue Cross Blue Shield would write you a check.
back. That's the way it should be.
Right, and then the overhead went to us.
The contract with the insurance is between you and the insurance carrier. How we got ourselves in the middle of that is
lazy doctors.
Yeah, it's fascinating because now
the AMA.
The other thing about it drives me nuts, and I know you all deal with it too. But let's just say there's a procedure at my office. It's $1,000. Well, if I'm contracted with Blue Cross Blue Shield, they automatically knock it to $600. Well, then they only pay 50% of that. So even though it said it was $1,000, he got $300.
Yeah.
You're barely making overhead at that point. That's why I'm down to 3 insurances. I had 12 or 15 at one time, and they just all quit paying. And people fuss at me, like, you want me to take $20 out of a $200 bill? I can't pay.
Can't run a business.
I can't. We'll be out of business next week.
The paper carrier makes more than that.
Yeah, you just can't do it. I just wish there was some way to educate patients on how the system really is.
Absolutely.
But there's really not. But that's another topic.
What's a $1 trillion
day.
business?
Yeah.
Number 1 lobby in the world. All right. Well, thank you, Bo.
You're welcome.
I really appreciate it.
Thank you for having me. I enjoyed it.
Absolutely.
I'd love to just say thank you from Genesis here in Boones Creek, and thank you from me as a friend and a professional peer. And could you just give another plug for yourself and where you are and how to reach you?
I really don't like doing that.
I know it's kind of on the spot.
The owner of Westmoreland Dental Group since 1998, so almost 30 years in private practice. Worked for the state of Tennessee for a few years, but I've been doing general, family, and TMJ migraines now for a long time.
Yep.
Added sleep apnea in, but yeah, I'm in my 30th year.
Well, that's fantastic. Well, like I said, here at Genesis, we like to have the best and the best referral sources that we can get, and that's why you get to sit in position A today.
Well, that's very kind.
So thank you very much, Bo.
Yeah, you're very welcome.
And
Thanks for having me.
I look
Seriously,
forward
enjoyed it.
to coming over and getting a TMJ or a TMJ workup, and you've already done that, but apparently I'm going to drop $2,300 on a sleep apnea device.
It's there if you
It
need
beats
it.
the Inspire that I was going
Yeah.
to do anyway. So
Yeah.
maybe. So thank you again.
You're welcome. Thanks for
Absolutely.
having me. I enjoyed it.
Thanks for tuning in to the Genesis Healthcare Podcast, empowering you to live optimally. Ready to take the next step? Visit thegenesisdifference.com today to learn more.